I'm sure you're really going to enjoy today's conversation with Dr. Betsy Greenleaf. Betsy started her career as a surgeon, specialising in women's health, and over the years she's become a leading expert in midlife wellness. Today, she runs her own menopause clinic, helping women navigate the many changes that come with this stage of life. In our chat, we covered some really important topics for midlife women, like how to manage weight gain, that midlife weight gain, whether HRT might be helpful, and how to think about weight loss medications. But we also went deeper into Betsy's specialist area, which is pelvic health. And we talked about practical ways to keep our vaginas healthy, happy, and thriving in midlife and beyond. So this is a conversation which I think you will find is insightful, warm, and has some really practical advice. So settle in and enjoy. Betsy, welcome to How to Feel Like a Midlife Goddess. I'm really thrilled to have you here today. I know you've got a rich background in women's pelvic health, hormones, and all things midlife vitality. For listeners who may not know you yet, can you tell us a bit more about your journey, how you went from being a surgeon to empowering women through a more holistic lens?
Sure. Thank you so much, Amanda, for having me on today. So, I went to medical school and wasn't quite exactly sure what I wanted to do. And I found myself drawn to the surgical specialties. And I actually started off in general surgery. And then fast forward, I was the person who kind of like was going around on the rotations and was more really concerned about people's feelings. And I found that like general surgeons are very good at what they do, but once they take out someone's appendix, that's usually the end of it. And I was the one going around. So like, how do you feel now that your appendix is out? And so then I realized that I probably would really wanted to have more of a relationship with my patients, and gynecology gave me that option. But I didn't necessarily like delivering babies because the baby part was fun, but babies come at all hours of the night, and I don't function very well, not in a lot of sleep. So I also found urogynecologgy, which is a combination of gynecology and pelvic health and bladder health, and so I ended up in that field. And in fact, it's a pretty new specialty, and that new meaning it started in the 1970s and didn't become a board certified specialty until about 2012, 2014-ish. And so I was lucky enough to become the first board certified female urogynecologist in the United States. I did that for 17 years. And then unfortunately, I had a car accident on my way to work one day when I was going to do surgery, and somebody pulled across 3 lanes of traffic into the back of my car. So then I ended up having a neck injury. And so I no longer do surgery, but I couldn't sit still. All my doctors and everybody were like, just be retired, just enjoy yourself. And I felt like I had a bigger mission on the earth and to try to make change, and especially women's health. And so at that point in time, I started teaching and lecturing and traveling all over the place. And somebody asked me a question about menopause at a conference I was at. And next thing I know, I don't know what came over me. I don't know if I lost my mind or if I came to my senses. I just blurted out that I was opening a menopause clinic. And then I went, oh no, why did I say that? But now here I am. That's why I'm in the process of doing that in New Jersey in the United States. And I've just been kind of traveling and teaching, and my whole social media is talking about midlife and how to live your best life after the age of 40.
Yeah.
So
okay. Great. Wow, quite a story. And how is your neck now?
Oh, my neck is actually not bad. I wouldn't be able to perform surgery, just the long hours of being in the positions that we have to be for surgery.
Yeah.
In fact, actually, interesting enough, gynecologists and dentists tend to have the worst necks. And so they end up often retiring early anyway from neck injuries. But because they're in this like weird hunched over position when you're doing surgery and procedures.
Periods of time. Yeah.
Yeah. And even on top of all that, so I actually, and I love education. So I'm one of those people who can't stop learning. So in that meantime of like being a kind of off of work, I'm working on my 4th board certification right now. So I'm currently triple board certified in obstetrics and gynecology, urogynecology, aesthetics, and then I'm currently studying with Dr. Andrew Weil and doing integrative medicine, which I already had kind of an integrative approach, but I wanted to make it official.
You are a busy lady by the sounds of it, Betsy.
Yeah.
Okay, so yeah, it's great that you're specializing in, women over 40, because it is when life starts throwing up lots of problems. And, this podcast is all about, helping us feel good, do the things to protect our future health and, mitigate symptoms that might come up. So it sounds like you're the perfect person. Now, I just want to talk about body confidence in midlife. And I know you talk about this, and you often say that women are worth more than we weigh. Why do you think so many of us are still attached, so much self-worth to, the number on the scale?
I'm not exactly sure where that originated, because I've often wondered, like, where in women's history did we become so obsessed with being skinny? Because at one point, the ideal body type was to have extra cushioning on the bodies. I mean, we look back through the history of art, and I kind of feel like maybe that happened in the 60s, 70s, 80s. And especially, I grew up in the 80s, so I guess it's probably also more than what I saw is, this aerobics nation that basically came out where, aerobic exercise became like so incredibly popular. And, people become very, very focused with the scale. But it's so like first of all, you could have 2 women walking into a room. One looks like a supermodel, super skinny, no fat on her body, but has basically no self-confidence. Maybe she's standing in a little, like, her shoulders a little hunched over and just a little self-conscious. And then you could have somebody that walks into the room and doesn't look like that traditional, like, super skinny, ribs showing model type. And maybe some people might call her chunky. I don't like some of those words, but but she walks in with all this confidence. People in the room will notice, and they'll be more naturally drawn to the person who's confident than to the person who's like super skinny and looks like, a mom. I think we got to kind of get away from this, that part of that ideal. And the other thing is the number with weight. I mean, weight is, and it's funny because I say this, but I struggle with it too, because guess what? What's easy to track and is weight. It's easy to just hop on a scale, but what does that number actually mean? I was actually, it's just funny. I was just at my integrative medicine doctor, and I was expressing how frustrated I was with the fact that I've been having difficulty losing weight. And so he had there's different machines that are out there. There are scales that do body composition, so we can look at percent fat, percent muscle. He had a more advanced one in his office, and we got on it, and he was like, well, look, he's like, a year ago, he goes, yeah, you weighed more. He goes, and there's not a lot of difference between then and now, but he's like, look at your body composition. He's like, you have a lot more muscle and a lot less fat than you did a year ago. So he's like, you can't look at the number of the weight.
No,
so
exactly. Yeah. And as you go forward, I mean, I'm quite skinny, and I'm always trying to build up my muscle, because I know, being super skinny, I'm much more likely to get osteoporosis. And and actually, even when you're, I spoke to another lady, actually, the previous podcast, we were talking about weight and why we attach so much self-worth to it. But, even when you're skinny, I mean, I don't think I've got like the perfect body. I think, oh my God, I'm so scrawny. I just think women, we are all, we just sort of self-flagellating. We just kind of criticize ourselves. Our inner critic is so quite judgmental to ourselves and also to other women. And I think, we kind of have to change that, don't we? And I think, like you said, someone walks into the room and it's all about the energy. For me, the energy that they bring is much more important than the size, shape that they are. So, yeah, I have to keep working.
And of course, there's also that level of being healthy. And, healthy doesn't necessarily look like a size 2, like, super skinny. I mean, we have to look at, at health too. So, I was thinking it's kind of funny. About a year ago, I made the comment about now that I'm in my 50s that my bikini days are over. I haven't seen a bikini in years. Like I used, I wore them in my 20s, and then between kids and work and all those, and then now menopause, I, haven't broken out or owned a bikini in years. And then all of a sudden, like last summer, I was like, this is ridiculous. Like, there's no reason that I can't wear a bikini. And so I bought one, and I started off with just wearing it around like my house, like the pool. And I was like, okay. And then actually there was one day that I wore it on a public beach. And I remember feeling so self-conscious and like really mortified. I don't know if I had this image that like I'd step on the beach and like, you know, men, women, and children would go running off the beach screaming. I don't know what I expected, but like I remember I kind of like had this little cover up, and I get out to my chair and I take my cover off, and I'm in the bikini, and like nothing happened. Nobody screamed, nobody like ran in horror. And I went, all right, you know what? No one really even cares. No one's even looking. Like I'm spending more time worried about what everyone else is seeing, but nobody is even looking, so nobody cares. So I was like, all right, well then I'm wearing the bikini. So
I mean, a man would just strip down, whatever the shape, and just wouldn't even give a second thought to anyone's thinking. They're just like, yeah, I'm here,
and I think the other thing is just the human form is beautiful in all its different forms. And I think that's, it makes us unique, is that we don't all look the same. So
Yeah, absolutely. Wouldn't that be boring? So moving on, Betsy, what do you wish more women understood about this stage of life, sort of physically, mentally, and emotionally? And I know you run your clinic, so you obviously see a lot of women over 40. So yeah, what's the thing that, more of us need to understand about this stage?
I think, well, there's a lot, but specifically, I'm going to go with this weight thing, because I've seen so many women who get to this point, and they're like, they want to, some people may have been skinny or whatever in their 20s or younger. Some people have never been that way, but now all of a sudden they're reaching their 40s and beyond, and they still think that they have to get to this ideal, quote, ideal body type, and they decide, well, I'm just not going to eat. And so they basically either over exercise or under eat or do both. And the body at this point in time is like, says like, all right, maybe that worked in your 20s, but that's not going to work now. Your body's like, not happening. And the combination of things that are happening is we start to lose about 8% of our muscle mass after the age of 30 for every decade that we live. And so muscle
in total, not
every decade that we live, we lose about 8% muscle mass. Yeah, starting at age 30. And that's if you don't exercise or do any kind of strength building.
Exercise, you don't lose it. I mean, on my
yeah, but it's a little bit hard. Yeah, it's a little harder.
They're working on it. They're lifting weights to maintain it. Yeah.
Yeah, there's definitely, you have to use different techniques. And I think that's one of the things, is that unfortunately I see women doing aerobics and not doing enough strength training, or doing kind of resistant training, doing something with weights or resistance. And they just figure like, I'll just do aerobics, I won't eat, and I'll get to where I want to be. And the body goes, And in fact, actually, I see this with some of the GLP-1 medications too, is that
the GLP-1 on these So just so listeners know what you're talking about. So it's Wegovy, Ozempic, Mounjaro, those drugs. Yeah, the weight loss drugs. Yeah.
Yeah, the weight loss. I see people doing them and then getting frustrated because they're not losing weight. And here's the thing is, the body likes to hold on to weight when we're stressed. And stress can look like a number of different things. Not eating enough food can be a stressor. Exercising too much can be a stressor. Not getting enough sleep can be a stressor. Not drinking enough water. Eating inflammatory foods like processed foods and high sugars. So all these things, the body goes, all right, I sense that I'm stressed, and then it wants to hold on to all its reserves. So maybe that yo-yo dieting and starvation dieting and over exercising worked in the 20s, but once you hit your 40s, that stuff doesn't work anymore. It messes up the metabolism. The body goes, I don't care what you're doing. I'm going to hold on to this because the body doesn't know the difference between you're trying to purposely lose weight versus like there's some worldwide famine and there's no food available, or, you've been in some kind of horrible accident and it's got to hold on to all its reserves. So that's where we really have to look at other techniques. And number one is going to be decreasing stress and trying to figure out where your stressor is. And the other thing
it does feel, doesn't it, Betsy, like that?
Yeah.
I mean, once you get to sort of 45 and you start going through perimenopause and menopause, it does feel like the stress response is kind of exaggerated.
Yes. Oh, yeah, definitely.
Yeah.
So, we're also battling not only as like, years of metabolism issues kind of catching up with us, but we're also dealing with lowering of our hormones. And so not only are we losing estrogen, many people have heard of estrogen and progesterone as female hormones, but we also have testosterone, and we're starting to lose testosterone after the age of 30 also. And it's really starting to catch up with us in the 40s and beyond. And we need testosterone to build muscle. So we're losing that. Also, estrogen and all these hormones also help with our mental health. They're neurotransmitters, meaning that they affect the brain, not just the body. And so, especially during the perimenopausal period is probably the worst time because these hormones are kind of all over the place. The brain is almost like in chaos. The brain is going like, I don't know. So then when you add one more stressor on top of it, it becomes like, okay, I can't take things anymore. So yeah, we're dealing with these changing hormones and drastically in the perimenopause period. Then afterwards, things kind of settle down, but we're still dealing with these low hormones, which help us be a little bit more resilient to the stress. And then the general stressors of modern life can really start stacking up. And typically people in their 40s, 50s, and beyond have a lot more on their plate than somebody who's like 18. So
yeah, I know it's ridiculous. We need that kind of resilience, don't we, at this age, rather than men. But hey, whoever designed the system. But yeah, it does sometimes feel like when you need all that energy is when you're feeling, most depleted. When you really need the
exactly
for the younger kids, for the older generation, and yeah, we're called the sandwich generation, aren't we, when we're trying to sort of manage both the elderly parents and sort of teenage kids. And yeah, it's tricky. So what is the answer? Do you prescribe HRT in your clinic, Betsy?
I do, but I also do it from a standpoint of it's a very personalized decision, because I'm seeing this on social media now where there are the people who are like very pro hormones. Everybody should be on hormones. And then there's the other side of it where people are like, we shouldn't be forced to take hormones and we should be able to age naturally. And it becomes a very personalized decision.
Yeah.
I think the biggest problem that we see is that starting with the Women's Health Initiative in 2001, there was a lot of misinformation that scared women out of taking hormones. And there were a lot of women that could have benefited from hormones that never had the opportunity because doctors and patients were terrified. We were all like, you're going to get breast cancer, you're going to get heart disease.
Yeah.
That study really got blown out of proportion in the media. It got published in the New York Times. It's kind of like if something came out that wasn't completely true and went out social media nowadays, it would, spread like wildfire and people would panic. Really looking back at that study, it was a poorly designed study. More of the issue was the combination of the estrogen and progesterone was the arm of the study that had more issues. But even then, on top of all that, it was the type of hormones that were used in that study, which were not natural hormones, meaning they're not what the type of hormones are naturally found in our bodies. So some people refer to the natural hormones as bioidentical. That is probably the more appropriate term. I just feel like that term has been overused and some people kind of cringe when they hear that, the bioidentical. I just like to say natural because we should be putting into our body what our body's naturally going to respond to. And then that brings up the question, like, why do these non-natural hormones even exist? And that was just purely a business decision because when businesses are making products, they want to protect their intellectual property, and they would be able to patent it so that they can sell their products and make money. Well, you can't patent what occurs naturally in the body. So the natural hormones cannot be patented. So how does a business then make money on something that they want to be hormone-like? Is they take a natural hormone and they just tweak the molecule. They put some extra things on that molecule, and now it's a new novel product that they can patent and sell. And that's the only reason that they exist. I, sitting here now, can say that my personal opinion is I think it's criminal that they exist and that they're marketed to women because of the fact that they're not processed in the body the same way as natural hormones. And even if we look at the Women's Health Initiative study, surprisingly, the estrogen only arm had more health benefits than they had risks, and that was even using the non-natural hormones. So, but my problem is that with the non-natural ones, they're broken down in the body and metabolized in a way that can produce toxic metabolites that can affect our DNA, which could potentially cause cancer. And the whole cancer thing is, and I had a conversation with a woman actually yesterday with this, is even like if you have the genes for cancer, it doesn't mean that you're going to get cancer. Because genes can be turned on and turned off. And that's like, that's a newer understanding about genes than from when I originally trained. It used to be like if you had the genes, that was your destiny. But just because you have the genes doesn't mean that it's being turned on. And even if you were taking the non-natural hormones, doesn't mean you're going to necessarily get cancer. And so, and then the other thing is, even with the natural hormones, as long as they're in balance, we're good. So, so that's another thing, is that just taking something that's natural doesn't mean that you're going to be perfect, because if you're taking too much of a good thing, like that's not a good thing.
Yeah.
It's just like it's like broccoli. Broccoli is good to eat, but if you ate only broccoli, too much of a good thing would be bad. You're missing out on other things. So.
But it's quite hard for women, myself included, but I do take HRT, and I I have clients that come to see me that don't take HRT and are thriving, but they are doing all the things like,
Yes.
they're making sure they eat enough protein, they're eating an anti-inflammatory diet, they're lifting weights, they're working on their stress. And then I have lots of clients as well that are taking HRT, but sometimes it's hard to get the recipe right. And in the UK, we see a GP, we generally get a very similar, estrogen and progesterone, and if we're lucky, testosterone recipe. And then it really is, if you really want to get, they sort of say around the testing that, if you test, the results often aren't accurate. And so it can be very confusing for women. And and it is true, if someone's taking too much estrogen or not enough estrogen, they just think, oh, HRT is not working for me, and it just kind of needed tweaking. Have you got any advice for women that are in that bracket, and what they can do to try and get that recipe right for them?
It's interesting, and when you're saying that with someone taking hormones and they say that it's not working, I see that a lot, where women come to me and they've been put on these hormones elsewhere, and they're very frustrated because their friend is getting, a response from it, and they're like, it's not working on me. It's not that it isn't working. So it's interesting. This also comes down to stress, because our hormones are processed actually in down two pathways. They all start with cholesterol. Cholesterol is often vilified, but cholesterol is our parent hormone. And in a nice relaxed state, that cholesterol will come down and be made into those sex hormones like testosterone, estrogen, progesterone. When we're stressed, those hormones start with cholesterol, they come down and they don't get made into hormones. They make a hard turn and they get made into cortisol, which can be, if it's elevated for too long, can really make us pack on the weight, make us more resistant to healing, and really cause inflammation. So often depicted is that that's a one-way street with these hormones, but they can back convert. So one of the problems I see is that if someone is taking HRT, hormone replacement therapy, and they're stressed, they could be back converting their hormones into the stress hormones. So, you're spending all this money on these hormones and your body's not even using it because you're just converting it into stress hormones. So it really, I mean, lifestyle is really the key to everything. And I see, unfortunately, a lot of women coming in thinking hormones are going to be this like magic, literally magic pill, and that it's going to fix all the problems. Like hormones are just a tool in our toolbox, and you really need to start with the basics of lifestyle. And then the lifestyle and the decreased stress is going to make the hormones work better. So that's one of the biggest, and when like lifestyle, it is the simplest things. I see so many people messing up on this is not getting enough sleep. I mean, we're really supposed to get 7 to 9 hours of sleep a night. I mean, if you're someone getting 5-6 hours of sleep, like you can't all of a sudden just go and be like, okay, lay in bed and try to do 8 hours because you're going to be staring at the ceiling and cursing me out and being like Dr. Greenleaf, you're on that podcast telling me I need more sleep, but I'm laying here staring at the ceiling.
Yeah.
I tell people to back off their sleep by 15 minutes a day or 15 minutes a week, whatever they can tolerate until they're getting that full 8 hours.
Yeah.
But the inflammatory foods that are processed foods and the sugars and not drinking enough fluid. There was some articles, and actually they haven't been able to prove this, but it's been quoted in a number of articles, especially with Americans, that 75% of us are chronically dehydrated. And I'm always telling people, drink more fluids, but people, they're reaching for the coffee when a lot of times brain fog and low energy is just a sign of dehydration. So like people are thinking those menopause symptoms or that low energy is,
We want a quick fix, don't we? It's like sometimes if I'm a bit low in energy, you're like, oh, I'll have a coffee, and there's good things in polyphenols in coffee, so you kind of can talk yourself to it. But this sleep and not being stressed is kind of a longer term strategy, and sometimes it's in the moment it's hard to get there, isn't it? But it's kind of working on it all the time. And I know myself, when I get really stressed and lack of sleep, day 3 or 4 of that, I'm like, oh my God, my hormones aren't working anymore, because I seem to get all the symptoms that have perimenopause. And just because, like you said, all the energy is going towards the stress hormones and there's not enough left over for sort of, Hey, just a quick pause to let you know that if you're navigating midlife and beyond, maybe feeling a bit flat or fed up with food, I've got 2 things that could really help. Firstly, did you know that I coach women through the Metabolic Balance Program? So if you're ready for something more personalized, this program is all about resetting your metabolism, supporting your hormones, and giving you a plan that actually fits your life. It helps you discover which foods suit you best, helps you manage portion control and satiety, and build healthy habits that last, whatever age you are. Want to know if it's right for you? Well, we can have a quick chat. You can book a free 30-minute call with me and we'll decide together. Secondly, my book, Feel Good for Menopause, is packed with real-life tips, simple shifts, hormone-friendly guidance, and plenty of delicious recipes to help you feel more like yourself again. So if you just need that bit of inspiration, do get yourself a copy. It's available on Amazon, or you can click the link in the show notes. Okay, let's get back to the podcast. Just thinking about women that don't take HRT. Now, I think it's possible to be healthy, but do you think it's, if you don't take HRT, do you think you're able to, stay strong as you get older?
Yeah, definitely. And I think it's big focus on that lifestyle, especially, diet and exercise. I mean, I think it's amazing that Hippocrates in 440 BC said, let food be thy medicine. And we kind of forgot about that. And we're kind of getting back around to that. So I think every once in a while, you might want to eat some like cookies, cakes, I don't know, fast food, whatever. I tell people, as long as you eat healthy 80% of the time, and then 20% of the time, you're going to be doing something social. There's going to be a holiday, there's going to be a birthday, there's going to be a special occasion. So 20% of the time, go enjoy yourself, because otherwise you get too rigid. And it's like, I've done that mental game where it's like, I'm on my diet. And then I eat something, quote, I shouldn't eat. And then next thing you know, I'm like, oh, well, I just screwed up the diet. I might as well just keep going, or oh, this is never going to work. Well, you know what? It's better to just take a deep breath and give yourself grace and then just start again. It's not the end of the world.
And it's the same with alcohol. I think generally speaking, I don't know, this is my observation. My daughter's in America actually studying there, and she just says people don't drink in the same way as they do in the UK. like we go to a pub and we're like, yeah, we have a few drinks and a good night. And we're kind of brought up with that, and drinking and having a good time seem synonymous. And if you don't have, you don't drink, then you're a bit boring or you're not having fun. Whereas Americans, I mean, they do enjoy a drink, but it's just not in the same way. And I always worry when I see women that take HRT and then, carry on drinking and, like the same as they did. And one thing I've really had to do, and I'm always advocating to others around me, is, I've really backed up on how much wine I drink, because again, that's, it seems like as soon as you start doing that, disrupted sleep, all of that stuff starts, coming into your life. Do you agree with that?
Yeah. And, the alcohol topic gets really funny because we see this research on what are called the blue zones, and these are the areas of the world where people are super healthy. And many of the blue zones, people regularly are drinking alcohol or have some sort of alcohol consumption in part of their lives. So then you get this like, oh, wine is healthy, we should be drinking wine. But then at the other side of things, there's science that shows that women should not be drinking, I think, like more than like 2 glasses at a time. And then there's like, I can't remember the number. I think it's like no more than 7 in a week or something like that, because alcohol can increase estrogen. So it can affect the hormones. I've brought that up, and I had one lady tell me, she's like, oh, if alcohol increases estrogen, why can't I just do that as my hormone replacement? It doesn't really work that way. So, but we do know that women, from the
unhealthy estrogen, isn't it, that you make and you release more estrogen into your bloodstream when you drink alcohol. Is that right?
Yeah. So and that's the other thing, is that like we do know that women who regularly drink or binge drink have an increased risk of some of the hormone related cancers, like breast cancer and and uterine cancer. But it's not so much because the estrogen. It could be that alcohol is putting a stressor on the system that's then affecting DNA damage, which is turning on those genes that cause cancer. So,
yeah. Now I really want to talk about pelvic health, because I know that's a big topic for you, and it's also, it's something that a lot of women start noticing as they go through perimenopause. But before we do that, we've been talking a little bit about weight loss, just wondering, and being the ideal weight in sort of inverted commas, but what's your opinion on the weight loss drugs like the Ozempic, Wegovy and Mounjaro? Because I'm sure you're seeing a real uptake in the US. I mean, I think 2.5 million people are taking them, estimated to be taking them in the UK, although the private prescriptions. But I think it's even, you were further ahead in the game in the US than we are here. So yeah, what's friends?
We're seeing tons and tons of people. Is another thing that I have very mixed emotions about, because there are certainly health benefits to some of these medications, because they're finding out that not only do they affect weight loss, but they can have effect on being heart protective, kidney protective, bone protective. And so, in fact, there are some
they have anti-inflammatory properties as well, don't they?
Yeah, anti-inflammatory, anti-aging. So there are people that are taking them just for the anti-aging aspects of things. But at the same time, things aren't perfect. And so the biggest problem I see with people is they don't change their diets. So they're still eating all these horrible processed foods and then going on these medicines. And unfortunately, a couple of things with that medicine: when you do start losing weight on them, you can't control where you're losing the weight. So you start losing fat. And there's a funny phenomenon, which may not be so funny to everyone, but they're calling it Ozempic face, where we start losing the fat pads in our cheeks, which, from an aesthetic standpoint, those fat pads that stay high in the cheeks keep us more young looking. And then when we lose them, we start getting a hollowed, more
one place where fat, right, is on the face.
Yeah, exactly. Or people are losing the fat in their butts, because it's called Ozempic butt. But then bringing it into gynecology, we're also seeing what's called Ozempic vulva, that women are losing the fat pads in the vulva, so that can affect sexual function, unfortunately, if you don't have a little bit of cushioning in that area. So, but in addition to like losing fat, people can also lose muscle, and muscle's more metabolically active. So then when people do come off these medicines, then we're seeing them gain weight and then some, because they haven't done anything to maintain or build muscle while they're on these medicines. And then if you're eating these poor diets full of processed foods and snack foods and everything, like, sure, you're losing weight, but what's happening with the body with inflammation and the risk of other diseases? So that's one of the problems that I'm seeing with these medicines. And then we do get people who just their systems are so stressed that they're just not losing anything. So they keep going up higher and higher and higher on these medicines. Actually, I honestly, this actually happened with me. I got so jealous of watching everybody around me lose weight, and I was not going to take the medicines. And I'm like, oh, you know what? Fine. Everyone else is doing it. I'm going to try it. I was on it for 5 months and did not lose anything. And I know for myself, it was probably my level of stress because I'm doing way too much. But I've seen other patients do the same thing where one of the things that these medicines do is that it affects our appetite. So patients will be on this medicine. They're not losing any weight because when the body is stressed, it'll hold on to weight. And then they're not hungry because they keep going up in the dosing, and then they're not hungry and they have to force themselves to eat, and then they're becoming malnourished because they're not getting enough food in. So they're not losing the weight, but they're not getting, the proper nutrition. It's kind of becoming a mess. But there are people who are losing weight and able to get off their blood pressure medicines, get off their diabetes medicines. And it's just giving them that win. So I have very mixed emotions with how these medicines are being used. I think the biggest thing is that they're being managed by a practitioner and not one of these online. We have these here in the United States. I don't know if you guys have it elsewhere. These online places where basically you just go like online, put your information. Next thing you know, the prescription shows up and nobody's managing it.
No.
So, yeah.
No, I totally agree because I feel that, if you are obese, you lose that messaging that you're full,
Yes.
that the GLP-1 will tell your brain that you are full, which is what you get with Ozempic, kind of exaggerated, or Mounjaro. And if you're obese, so you want to break that cycle. And if you do something, I coach for a program called the Metabolic Balance Program, which is essentially 3 meals a day with protein and anti-inflammatory foods. But if you do something like that, and I've got some clients now doing it alongside, I'm really hopeful that they can come off their weight loss drugs because they will have been educated and they've brought those cravings down, learned how to eat, come off the drugs, and they won't be in that 75% who gain the weight back within a year.
Yes.
However, what I'm seeing is people that are not obese taking it, and I'm not judging anyone, everyone, we all live in our own bodies and, it's up to us. But then they don't eat anything. And I think you touched on this. They don't eat anything. And I must say, if I wasn't hungry at lunchtime, would I go and make lunch? I'm not sure I would because it's a pain in the butt sometimes. I love eating, but at lunchtime I'm often quite busy. And, if I could just, have a quick snack for 10 minutes. But because I understand nutrition and I know the effect it has on my body and I know how good I feel when I'm eating 3 meals a day, I do it. And I'm driven because I'm hungry. If I didn't have that drive, I wouldn't eat it. And what we're seeing in this country is young women, maybe young men as well, but this is my focus, younger women, they're not even, they're like size 12 or 14, not really overweight, just a little bit bigger, not that super skinny. They are taking it and then they are not eating anything. And future health, having nutrient deficiencies, having muscle deficiency, and it's not so easy to build up muscle once it's gone, is that? So that's where I worry, where I think it can be problematic. And I don't know what you think about, there was, I was in London last Tuesday and we have like a London newspaper called the Metro, and there was a headline, I took Ozempic for a year, I lost 8 stone and an organ. Yeah, I'd do it all again. And she'd lost her gallbladder because, she hadn't been eating. And I suppose the bile and the cholesterol build up and then kind of, poison the, damage the gallbladder. And she'd had a gallbladder out. I mean, do you know anything about that? Do you feel that's
there's also risks with the medicine. We've got risks of pancreatitis, that can affect the gallbladder. It slows down the motility of the intestines. And one of my passions is the gut microbiome, because the gut microbiome is the bacteria that naturally, and the organisms that naturally occur in our gut. And they're finding it has such a broader effect on our overall health. And I'm wondering, if we're slowing down our gut motility. That's one of these, how the medicines work by slowing that down, and you end up being less hungry because you feel full longer. Like, what are we doing to the gut microbiome, and how is that affecting our overall health? And, and this all could be a stressor. If you're malnourished, that's another stressor. That's going to affect your hormones. That's going to affect, that's going to affect your weight. So I'm not, it's interesting because at the same time, what's happening, because I often lecture about weight loss to doctors and nurses, and we're talking about Mounjaro and Ozempic and all that now. There's about 30 new medicines that are in the pipeline that are for development, all working in very similar ways, but are supposed to be even better. But I think that the whole thing is that this is not supposed to be like long-term, these medicines. They're not supposed to be like your backup plan. It really got to still come down to like lifestyle and healthy living. And it's kind of just, the whole thing kind of makes me a little nervous.
Yeah. And some people go immediately into like high dose Mounjaro, which works on GLP-1 and another mechanism, doesn't it? So am I right in saying it's slightly weight loss is slightly faster on Mounjaro than it is on Ozempic and Wegovy, and I think you can lose 20% of your body weight in the first year on Mounjaro.
Yeah. So they say like the goal for most like non-medicine.
Most people sounds amazing. It's like, oh yes, please. But if you take too high a dose too quickly, are you going to get more issues?
Yeah. Oh, yeah. I mean, and that's the thing. Well, and sometimes too with the dosing, you don't necessarily. Everyone thinks like more is better, but you don't necessarily need to be on the highest dose to get some results. I mean, you just be on the dose that you get the more that you can tolerate, because there's definitely side effects and risks. And I think long term, we don't really know all the effects that this is going to have on the body, because what we're seeing in the United States is not just the pharmaceutical companies who've done the research putting these medicines out, but we have compounding pharmacies that are putting these medicines out that aren't exactly the same medicine. So we don't even know the long-term effect. There've never been studies on these medicines, so we don't really know the long-term effects. So it can be quite scary. And like I said, if you're on the medicines and you like, I think it's great if you need to like get over the hump, because especially in that menopause period, like sometimes that weight just doesn't move. So if you can, if it's something that we can kind of like get you a win, that's great. The other thing I was going to say is like most diet, exercise, weight loss plans, they shoot for about a 5% weight loss goal. Like that's considered successful if you lose 5% of your weight, and then you just keep repeating it until you get to the weight that you want to be. So you can't start at like 200 pounds and get to 130 pounds and be like overnight. Like it's got to happen in slow increments. The medications have been quoted as between a 15 to a 24% weight loss with the medicine. So it can be faster, and it can
but
be
not necessarily in a healthy way. And I have, I've been a nutritionist for sort of 13, 14 years now. And I obviously done a lot of weight loss because, people walk through there, I've got eczema or I've got an autoimmune condition. Yeah. To help me lose some weight, it's a struggle for a lot of people with the Western diet. And I find the people that get the weight off and keep the weight off, because there's one thing doing the diet and getting to your target weight, is something else sustaining it, are the ones that have lost weight really slowly. And some people come in after 2 weeks, go, oh Amanda, I've only lost half a kilo or 700 grams. I'm like, that's great, just plot that. If you keep just keep repeating that, the graph is going down and you will get to your target weight. Whereas people that lose all the weight really, really quickly, they just bounce back every single time. So it is much better, isn't it, to lose it in slower increments. Anyway, I know you've got, I wanted to finish with some, talking about pelvic health, because I know that's your area, and it's something a lot of us struggle with, wanting to go to the loo like really quickly, like almost like you can't get there quickly enough to urinate. Sore, they can be quite sore down there as well. A lot of, urinary tract infections seem quite common after, sexual intercourse. Can you tell us a bit about that and give us a bit of advice on how we can sidestep?
Yeah. So there's a lot of different factors, and we could probably spend hours just on that.
Yeah, I'm sure.
But, one of the things that are happening, two big things that we can make a difference in is number one, we start losing about, I said, 8% of our muscle mass every decade. People don't think about their pelvic floor muscles until all of a sudden they're having symptoms. And those symptoms can be more difficulty holding in your urine when you have to go. Extreme, it could be actually difficulty holding in stool or gas. You can also have decreased sexual function when those muscles have starting to get weak. So, and even sometimes developing things like a prolapse where the vagina or the bladder is like leaning on the vagina and things are kind of like bulging.
Yeah.
Though that's not fixed by Kegels, having a stronger pelvic floor can help with the symptoms. So doing Kegel exercises or some kind of pelvic floor exercise is really important. And I find that a lot of
What are those?
what
So
the Kegel exercise.
Yeah.
Yeah. So I find that a lot of women don't do them properly, even if they do know about them.
Okay.
So the Kegel exercise will be like doing exercises to tighten your pelvic floor. And so what I stole this explanation from a friend of mine. He says, like, picture that there's a giant straw coming out of your vagina and that you're sucking up a thick milkshake. And so if you were trying to suck up a thick milkshake through your vagina, it'd be like a lifting and sucking movement. And so it's more of this lifting movement.
Which you never do unless you think about it, do you? You just wouldn't do it in normal life.
Yeah, exactly. And so we really need to be putting time because we start to lose that muscle and then all of a sudden we have problems with leaking urine. And so you want to keep doing those exercises. And there's a couple different ways.
You need to do them? How would
like with any exercise, like regimen, you want to start slow. You don't want to start like doing a bunch of them all at once because you can fatigue those muscles and now have symptoms where you're not holding in your urine or stool or gas because those muscles are too weak now because they've been tired. So I tell people just start with like 10 a day. Even if you can't do 10, then that's fine. And they can be done of a couple and not every day. Maybe do it like 2-3 times a week. And then just keep adding it on like the 10 repetitions, like do that, like you move up to those 3 times a day and you don't have to do them all at once. It could be over the course of the day. And then what happens is, you definitely want to, there's a couple ways to do it. You can tighten those muscles and hold them to a count of 10 and then relax. Or you could just tighten and relax, tighten, relax, tighten, relax. And do that 10 times. Or you can do what's called quick flicks where you really go very fast. You go like tight, 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 and then, and relax in between. And so they're using different muscle fibers when you do them differently like that.
Yeah.
Unfortunately, I too often see women who tell me that, oh, I do it every time I urinate. And that was something that was told to women in the past. But it was to try to figure out which muscles to use. So when people are urinating, they'll sometimes stop the stream of the flow of the stream of urine. And they think they're doing the Kegel exercise, which, yes, those are the muscles that you want to use, but you're only supposed to do it when long enough to figure out which muscles to use. Because if you stop the flow of urine while you're urinating, the bladder is a big muscle and it's pushing. And if that urine is not coming out of your body, it could go back up to your kidneys. And so it can increase your risk of kidney infection. So you don't want to be doing those when you're urinating.
No, so they always talk about tagging habits, don't they? So maybe if you're brushing your teeth, set to your 10, or if your 10 pelvic, kind of imagining. I love the analogy of imagining a thick milkshake. It sounds like quite an effort. But if you're sitting at a traffic light, but otherwise, I get quite enthusiastic and I'll do them for a couple of weeks and then I just forget about them.
Yeah, I know. Even if you have to send a reminder. I know I do. And honestly, even though I talk about them all the time, sometimes I forget to do them. And then I'm like, oh, wait, when it was been the last time. So I've had to start setting myself reminders.
Yeah, because it is so important, isn't it? If you can keep them, kind of, I don't know what the word is, but if you keep them muscly, you're going to have less problems. Yeah. And what about, a lot of women get urinary tract infections.
So that urinary tract infections and also the discomfort with intercourse that starts happening in perimenopause and menopause, a lot of that is coming from lack of estrogen because as our estrogen decreases, the vaginal tissue becomes very thin. And so a couple of things that are happening is when it becomes thin, we also lose some collagen and elastin, which kind of keeps the tissue stretchy. And so sometimes women can have sexual activity that can be very uncomfortable, can be dry, can be feeling like cut glass. There are tons and tons and tons of things that can be done to rejuvenate that tissue. Anything where from like topical hormones, and then the more extreme would be laser therapy. So using light energy to regenerate tissue.
About this, yeah.
Yeah, so anything that they've really figured out, that anything that you could do to your face for cosmetic things for rejuvenation, you can do to the vagina. So anything from like light therapy using lasers, radio frequency therapy uses sound waves to generate heat that can rejuvenate that tissue. Platelet-rich plasmas using your own blood and growth factors, and they draw some blood and then they basically place it back into the vagina to rejuvenate the tissue. In Europe, the carboxy therapy is really big. Carboxy therapy is where they basically take carbon dioxide gas and put it underneath the skin, and that attracts oxygen and causes the tissue to regrow and heal and become healthy. So, and then red light therapy, there's red light wands where you can do this at home, and red light is very anti-aging, and they have made ones that can go in the vagina. And then like I said, there's the traditional, like using topical hormones, or if you're doing hormone replacement therapy, depending on what type of product you're using, those hormones could just be put directly on the vulva and vagina to help with that tissue. So, because the other thing is, not only we're losing that elasticity, but the microbiome is shifting in the vagina. So the microbiome, once again, that bacteria and organisms that keep an area healthy, is shifting, because when the vaginal tissue starts to thin out, the healthy bacteria that normally lives there starts to lose its food supply. And so now other bacteria from our environment, from our gut, starts coming in, and now we're at higher risk of vaginal infections and recurrent bladder infections, because the vagina is right next to the urethra, which is the tube that attaches to the bladder that we pee through. And so the vagina can be a reservoir for, quote, bad bacteria that now can get into the bladder and cause recurrent urinary tract infections. So this is why it's really important.
They are so miserable. I mean, I had them myself. I don't get it anymore, but they are so miserable. One after the other after the other. It's such, and
that's
it's so common.
Yeah, not only that is like maintaining and helping the vagina important, but our diet also comes into this, because if you have poor gut health, let's say you eat a diet that's very high in processed foods and sugars, you're more likely to have more yeast in your gut. And if you have more yeast in your gut, the anus is very close to the vagina, and it's definitely important to be wiping front to back, but even then, you could be the cleanest person on the face of the earth. It's very easy for that bacteria or yeast to transfer from the anus and rectum area into the vagina. So a person who is often getting recurrent yeast infections is often coming from gut health to begin with. So
there's a lot going on with it, isn't there? So I mean, if you are someone's struggling with urinary tract infections, I mean, when I started taking HRT, touch wood, I haven't had one since in 5 years, so that's been great. But yeah, I know people can use topical estrogen as well, can't they? So they can use topical, and they can use it internally, and it's a very small dose. And again, it helps that tissue, like you were talking about, it helps it to be more plump. So would you say that would be a good way forward?
Oh, definitely. Definitely. That's definitely one of the great options, because we just basically want to rejuvenate that vaginal tissue and kind of return it back to how it was before, so it supports the healthy bacteria. Yeah. So really, it comes down to, the estrogen is really creating an environment that the healthy bacteria wants to be there, and the healthy bacteria keeps us healthy by chasing out all the bad guys.
No, absolutely. Absolutely. And so we've talked about pelvic muscle, we've talked about the sort of tissue. Anything else you wanted to add to that we can just sort of keep that area up tip top and, symptomless? And if you're not taking HRT, I mean, the laser treatment you talked about and the red light therapy, I think it exists in this country. It's not commonplace. And so I'm thinking about, I know seed buckthorn can be quite a nice oil to use. I don't know if you've got anything else you'd add to that, someone who's not using HRT, or, some people just don't want to take hormones or use hormones. So yeah, any advice for people like that might?
Yeah, the other one. So the biggest problem is if we're not creating an environment in the vagina where the healthy bacteria likes to live, it's very difficult to kind of balance things. But it's more so important to pay attention to gut health more than anything at that point in time.
Yeah.
And so getting enough fermented foods is going to be big, because I think as humans, we probably evolved to eat a lot more bacteria than what we do in our modern diet. And so getting more fermented foods, whether that's like yogurt, if you can tolerate dairy, or kombucha, which is fermented tea, or kimchi, the more bacteria that we get into our gut, the healthier our gut will be, then the healthier our vagina will be.
Yeah.
So that, that can be really good. I usually tell people to shoot for like one type of fermented food a day. You can also supplement with probiotics if you're like, hey, I just don't like those foods. And when it comes to taking a probiotic, I tell people that really you want to make sure you get one that has as many different types of bacteria in it as possible, because they're finding out that having a diverse exposure to many different bacteria is actually more important than one specific strain of bacteria. So and I think on the market now, and pretty much everywhere, there's ones that are made that are like women's probiotics, and then they tend to have, what we're looking for. Yeah, the only other trick that I have that I absolutely love is, let's say the vagina is off, or you are getting recurrent like odor or itching and burning down there, or recurrent urinary tract infections. Sometimes, when your computer doesn't work, you just you turn it on and turn it back off. Turn it off and turn it on, just reboot the system. I like using boric acid to reboot the system. So using like boric acid suppositories and having people use them and put them in the vagina. They're not.
Wait, what are they? Sorry, I don't know what they are.
Yeah, so boric acid is derived from sea salt. And it's the vagina should be very acidic. And when we get into perimenopause and menopause, it starts to lose that acidic level. And that's why we get some of these bad bacteria. So using things like boric acid, and they usually come in like a little suppository that can be put into the vagina, or little capsules that can be put into the vagina. And it basically just resets the whole system. So it makes the vagina more acidic, and so more inhabitable for the healthy bacteria. So, and sometimes when you have itching and burning and discharge and odor, you can't tell the difference between, is it yeast infection or is it a bacterial infection? And the nice thing with boric acid is it just resets the acid level of the vagina. So you don't have to worry about, is it yeast, is it bacteria, because it usually takes care of both.
Yeah. And do you take that once in a while, presumably?
Yeah, when people have symptoms, I'll have them do it, and usually no longer than a week, like 5 to 7 days. And in the United States, we can get it over the counter. I don't know, how it's available elsewhere, but if your symptoms are going longer than a week, you really need to get a health practitioner involved to see what's going on. Or I have some people who do it if they kind of find that they have issues, like let's say they are a woman that has sex with men, and what happens is the vagina is very acidic, but semen is very basic on the pH scale, on the acid scale. So sometimes having sex with men, especially if they ejaculate inside, that can throw off the pH of the vagina, making a woman more susceptible to infections and bladder infections. So sometimes I'll have them after sex just like pop in a boric acid suppository to help reset things. Or during the summers, if people are in wet swimsuits, you're more likely to get a yeast infection. You can always use like just one boric acid suppository just to kind of rebalance things.
Right.
So
I'm going to have to, that's new to me. I'm going to have to look into that. But thank you for that.
Yeah.
Betsy, this has been a great conversation, but can I ask you, before you go, if you could give women listening just like one message? We've talked about lots of things about how diet and lifestyle and sleep and stress is so important. But if you could give women listening one message about thriving in midlife, what would it be?
I think the biggest thing is actually going to be give yourself grace, because a lot of times in midlife, we have so much on our plate, and women often tend to put everyone else first and not themselves. and really just take a deep breath, put it on your schedule. Just have some me time, because really that's going to be important for all your other things to work better. Your nutrition to work better, your sleep to work better, your hormones to work better. If you just get some sort of relaxation, some me time, some space, like it doesn't have to be a lot, but just really make sure that you are putting yourself first, because like they say on the airplane, put your own oxygen mask on first. Like nobody else is going to be able to do well if you're suffering. So, yeah.
I think we need to hear that message a lot. Put ourselves first. It's okay. It's okay to put ourselves first.
Yes, you have permission.
Yeah. And finally, this podcast is called How to Feel Like a Midlife Goddess, because I believe that it's all about how you feel, isn't it? Not how you look, not the shape you are, not how a few wrinkles you have. It's if you feel good, you can just do anything in life. But what does feeling like a midlife goddess mean to you personally, Betsy?
Yeah. What pops into my mind right away is you are what you think. And so really monitoring your thoughts, because if you keep telling yourself like, I am a goddess, I'm amazing, I'm powerful, I'm sexy, I'm confident, like just telling yourself, you're over time, even if you don't believe that right in this moment, even over time, you say that enough and you will become that. And so, that goes out into the world, and the world sees that. The world sees your confidence, your beauty, your sexiness. So really, think that you are special, you are important. And here's the other thing. I know that people are going to be listening to your podcast and they're going to realize like you're actually doing some amazing things in the world, because people will look back when they first found your podcast and realize for weeks, months, years to come, they're exactly where they need to be by continuing to listen to you. So they just need to, not only keep listening to you, but also follow people that are going to be, supportive for their mental health and for their confidence and well-being.
Yeah. That's brilliant. Really well said. Betsy, I've loved this conversation. I love your enthusiasm and all the energy you brought to this conversation. But I'm sure a lot of my listeners would like to know more about you. How can they connect with you?
Yeah, so I'm all over social media as long as I don't get kicked off, because sometimes I kind of piss off the social media gods by saying things that they don't like. So, but if you look for just Dr. Betsy Greenleaf, Betsy, and then Green and Leaf, you'll find me in any of those forms, of pretty much on every platform that's out there. And I love to interact. So make sure that you like, follow, and kind of send me a message, because I love to hear about it. And then the other aspects is I have a website called the Pause Institute, like menopause, but without the meno. So pauseinstitute.com. And on there, there's a free hormone quiz. So anybody can take that and kind of get an idea where their hormones might be. And then additionally, I have a website called the Pelvic Floor Store, where I sell a lot of pelvic health products. Started off with the products I was recommending to my patients, and then we put it in a place that was convenient for them to get it. And so I will actually give you a code for 10% off for your listeners for the Pelvic Floor Store.
Lovely. Well, thanks, Betsy. You have a great day over there in New Jersey. And hope to speak to you again sometime. Thank you again.
Thank you, Amanda.
If you enjoyed this episode, don't forget to subscribe so you don't miss any future chats. And I'd also love it if you could leave a review and share the podcast with friends. It really helps more midlife women find these conversations and feel empowered in their own lives, because it is a busy world out there in the podcast sphere. And if you'd like to support the podcast directly, you can buy me a coffee. There is a Buy Me a Coffee link in the show notes below. Every cup really helps me keep creating content that's meaningful for women in midlife. So thanks again for listening, and remember, you are a midlife goddess.